to sort of convene virtually to continue our engagement and learning. Today we have Dr. Hari Prasad, who is the president of Apollo Hospitals, and a very leading thought leader, I would say, in the industry. And I personally follow his learnings and views that he puts out for my personal learning as well. And we couldn't have had a better person than him to just start off with the AMPH leadership talks for the class of 2022. Dr. Hari Prasad sir, thank you so much for accepting to come spend time with us on a Sunday morning. I really appreciate this. As you know, AMPH is a mid-career program that ISB runs for people from the healthcare delivery space. We hope the objective is to, of course, get a cadre of leaders in the industry, and then I hope we are meeting that objective. And then we have a fantastic class of 51 this year. About 90% of them are clinicians, but some of them have already moved on to do administrative roles. We have people from allied industry as well. It's a very fantastic, vibrant, highly motivated class. And also we have a few alums from the other classes who have joined in to listen to your talk, sir. So I'm going to hand off the session to Smita Chowdhury, who is a class champion, who is leading this and other co-curricular learning with her other colleagues, JP and Shilpa. So over to you, Smita, to formally introduce Dr. Hari Prasad to the class. I know he doesn't need introduction, but still for completeness. And also if you can sort of share the structure you're using for the discussion today, it will be helpful so that everybody, all the participants can accordingly contribute to the discussion. Smita, over to you, please.
Thank you, Soumya. Good morning, sir, Dr. Hari Prasad, sir, and good morning, everyone. Thank you for joining us. First of all, I feel extremely privileged to be introducing you to the class, sir. Dr. Hari Prasad, President of Apollo Group of Hospitals. I'm sure most of you already know him, and he needs, like Soumya said, he needs no introductions, as his journey and accomplishments itself are an inspiration to many of us. Just to give a brief overview for people who do not know, he's considered the father of emergency medicine in India for his efforts in creating a platform to establish it as a separate specialty on its own. With his strong leadership, he has been instrumental in sustained growth of Apollo hospitals in Hyderabad and in maintaining a cohesive working relationship across all multiple hospitals in the central region of Apollo Group of Hospitals. His focus has always been on creating a transparent learning environment with no blame culture within the organization. And so for his contribution to the healthcare industry, he was also awarded the Most Trusted CEO of the Year, 2018 from Leaders. So we are very thankful for accepting our invite to be the very first speaker in AMPH 2022 Industry Leaders Talk Series, sir. I'm pretty sure all my friends and alumni who joined us are eager to listen to you talk and interact. Just to give a brief understanding of how the talk's going to go. So Dr. Hari Prasad sir will be talking to us first, and then Dr. JP, he will be moderating the session, question and answer session. So we'll have equal amount of time for sir to give his talk, and then you will have a chance to have question and answer session, which will be moderated by JP. So hope everybody finds it interesting. Over to you, sir. Thank you.
Thank you so much and good morning. Pleasure to be with all of you on a Sunday morning. Thank you for taking time off on a Sunday morning and being here. Let me share my screen first. Right. I hope you can all see my screen.
Yes, sir.
Right.
Yes, sir.
So,
yes, sir.
I'm going to speak very quickly, about 20-25 minutes, and then I think we'll spend more time talking to each other and trying to understand each other. Now, these two gentlemen you see on the screen are the one in the white shirt is my father. The other one is Dr. Pratap Reddy, who is the chairman of Apollo Group of Hospitals, and the two who have influenced me the most in my life so far. And I had a few questions, same questions for both of them at different points of time. And I was amazed to see that the answers were very much the same, which I thought would be a learning for you. Both of them were very, very successful people in their own domains. And so the first obvious question, what I asked them was, what is the secret of their success? And both of them said right decisions. That didn't mean anything to me. So I probed a little further and said, how do you make the right decisions? And both of them said experience. Again, that didn't make sense to me. So I went and probed a little more and said, how do you get experience in making the right decisions? So their answer was very simple: learning from the wrong decisions they've made in life. So I'll start off with a story. I'm sure all of you know this man on the picture. It's Albert Einstein. He was one of the greatest brains Earth has ever seen. And during his days when he was inventing multiple things, he used to go and give lectures about all his inventions at different places. And he had a very faithful driver who would go with him along to all the lectures. And he used to go into the audience, sit and listen very faithfully, very attentively. On one fine day when he was going for a lecture, the driver told Albert Einstein, today I will give the lecture, you sit in the audience as a driver and listen to the lecture. And Albert Einstein, being what he was, he readily agreed for it. And he said, that's fine, go ahead and give the lecture. So he went ahead, the driver gave a lecture, a fantastic lecture, and he got a standing ovation for it. At the end of which, obviously, like we have in today's session, there was a question and answer session. So one of the guys got up and asked a question. This guy knew nothing about it because he had just parroted out what he heard from Albert Einstein without understanding what it was. So he did not know what to answer. But he did not get scared or flabbergasted. Instead, he was very, very calm. And he said, oh, you don't need to know the answer for this question. It is very simple. My driver sitting in the audience will answer it for you. So he pointed at Albert Einstein, who got up and answered the question. And at the end of the whole session, he got a big ovation. So the reason I started off with this is to tell you guys that I'm not a qualified manager. Like you are all, some of you are already or are going to be. So I don't have any pretensions of being giving a lecture on management. And I'm sure all of you would have heard that keep your professional life different and away from your personal life. All of you would have heard this. But I've learned over the years that it is all rubbish, because the personality is the same and you just can't, you are what you are. You can't be different at work and you can't be different away from work. So you are a personality and you're creating a personality for yourself, and the personality is going to remain the same whether you're at work or at home. So what do we learn from this story which I just told you? First thing is, when an idea comes to you, don't ignore it. Think about it, dwell upon it, and make sure that the idea gets its importance that it deserves. And then think out of the box, like both of them thought, both Albert Einstein and the driver thought, think out of the box, because thinking out of the box comes up with new solutions which you would never have thought of in the past. And if Albert Einstein was like one of our many managers that we have across the system who would resist change, then he would not have allowed the driver to speak. So allow change. That's a big thing which we all need to learn. And the last thing is, you will never know everything. At whatever stage in your life, you will never know everything. But the most important thing to know is to know your limitations. The driver knew his limitations, so he did not attempt to answer the question. Instead, he simply passed it on to Albert Einstein. So that's the moral of this story which I've told you. And what I'm going to do is, as I told you, I'm not a qualified manager. So I'm going to, but there's a lot of things which relates between life and what we do at work. So I will take you through what I went through in life and give you a few things which to ponder upon and to think about when it comes to life and how it relates to your work and how it works out when you're in your work environment. So when I was a child, I was born into a large family. I had a grandfather who used to dote on me, who used to give me everything on the sly. My grandmother, who would always say that your father is a great doctor. Right from the age of 2 or 3 years, I remember that. So you have to become a great doctor and look after the nursing home that your father established. That was my grandmother's story. And my father was always stern looking, very, very disciplined, but at heart, very kind and soft and loved all of us. And our mother was always there for us. She was a housewife. And I had 2 lovely sisters who we grew up together. And the best part of this was, even today, all of us are together, not only us, but all the siblings, all our children are all together. And so the important thing which I wanted to convey with the family story was, it is the most important foundation in your life. Your family lays the foundation for what you become in the future. And each member of your family has an expectation from you. Don't let these expectations override your passion. You must understand the expectations. You must try and deliver to these expectations, but never, never let them overcome your passion, and never let them, put you in a situation where you give up doing what you want to do most. So that's a very important learning in life, as you would see later, as I go through the rest of it. And this family life of yours, when you were a child, is equally important for your children, because you're going to give your children what you got from your family. So that's very, very critical. And you must make sure that you think backwards and think what happened to you when you were a child. Then the school. I happened to study in the Hyderabad public school. I was an extremely bad student who just managed to pass the examinations, while my parents and all thought that I was a brilliant student. And I used to do many other things except studying. I was in all sorts of sports. I was in all sorts of extracurricular activities. But the most important thing which I realize now is, it was the foundation which was laid in the school which gave me the confidence to do what I'm doing in life today. It is the foundation which allowed me to become a multifaceted personality rather than a bookworm. The leadership qualities that the school developed in you, in every individual in the school, was the beginning for many of us who passed out of the school. You would know that many of the HPS alumni are leading the largest institutions in the world today. So it is the school which is the formative years of the school and of an individual, and the support you get, it makes a tremendous difference in your life. I'll tell you for an example. The school used to encourage all extracurricular activities apart from studies. So I was playing under 15 for the state, and I was selected to play for the South Zone for the under 15. And those days we were doing the ICSE, which was the Indian School Certificate Examination for the 10th. And the final examination, the board examination, used to be in the month of February. And the national tournament for the under 15 was also in the month of February. So I thought I would not be able to play it because I knew that my family would not allow me to lose a year for cricket. And so I was almost ready to give up that tournament and write the examinations. Not that I was prepared for the examinations. But my physical director came back and said, you go ahead and play the tournament. I was a little surprised because I didn't know how he was allowing me to miss a year of academics and go ahead and play cricket. Then I said my dad would not allow it. He said, I'll talk to your dad. Then he called up my dad in front of me, and he told him that let our son go and play cricket, and we will make sure that he doesn't lose a year. So my dad asked the obvious question, how is he not going to lose a year because he's not going to miss the board examinations? He said, I'm going to give him a TC from the school, so he will go and play his cricket tournament. And those days we used to have the SSC examinations, which are the state board examinations, and they used to happen in April. He will write the April examination as a private candidate, and then I will take him back into the 11th once he passes those examinations. So that's exactly what happened. I went ahead and played, and that started the beginning of my cricketing career. And I came back, did the SSC, and joined back school in the 11th standard. And all through my 11th and 12th, I was playing cricket and nothing else. Less than 5% of the time I was with the books, and more than 95% of the time I was on the cricket field. So obviously when the 12th examinations, which were at that point of time considered pretty tough, came, everybody knew that I would fail. And I knew that I had to do medicine. I had no choice. But here I was struggling to pass even the 12th examination. And in those days, to write an entrance test, you had to get 50% in your biology, in your sciences, that's your biology, physics, and chemistry. So I almost gave up when my principal called me and said, I was coming from home, I was a day scholar till then. He said, you come and join the boarding school and we'll try and help you to catch up with your studies about a month before the examination. So I joined the boarding school. He made sure that all the teachers spent a lot of time with me during that 1 month and taught me. But again, even during that 1 month, we used to jump out of the compound wall of the school, go for late night shows, did all sorts of stuff. But finally, I did write my examination. And I was away in, I remember a place called Mount Abu for a cricket tournament when the results came. And I got a telegram saying that you passed your 12th examination. I was not very thrilled because passing the examination was not enough for me because I knew my family wanted me to get that 50% and be eligible for the entrance examination. So I was very worried whether I got that 50% or not. So I came back and I went to the school. And when I looked at the notice board which displayed the marks, I was actually surprised. I was stunned because I got in biology, physics, and chemistry 49, 48, and 53. When you add all the three together, it was an exact 50% that I got. And even if I wanted to do it on purpose, I'm sure I would not have been able to do it. So that was the sort of support that I got from the school. And that laid the foundation for me to become what I am today and to move ahead with what I did in life. There's some problem with this. Yeah. So what the school taught me was what you want to become in life is in your hands. While the environment can be created, you could be supported, it's ultimately in your hands to do what you want to do. And character is the most important thing in life. And you look at the character of any successful person in the world, you will really understand the strength of the character, strength of the personality. And this building of the character and personality happens in school and right in your formative years. And growing yourself starts from knowing yourself. So I knew from the beginning that I was never going to be a bookworm. I was never happy to become an academic person who was, philosophical and was reading a lot and writing a lot. But I knew that I wanted to become something different. And that is what happened in school. And that's what the school gave me an opportunity to become. And I wanted to tell you this story again. Now, my mother tongue was Telugu, and I was extremely bad at Telugu, very difficult to write or read. And unfortunately for us, the second language in the 12th examinations was Telugu, and I had to pass that to pass the examination. So what we did was, my friends knew that I was extremely bad at Telugu. So there was a Pandit, the guy you see in the blazer on the photograph was a good friend of ours in the hostel. And he used to make me sit down and tell me, teach me Telugu like stories. Like, he used to tell me a chapter like a story, and hope that I would remember it like a story and go and answer a question in the examination. That was my learning. I never read a textbook in Telugu for my IC examination. So when I went for the examination, I did write the examination. And the second huge surprise that I got after the results was I got more marks in Telugu than the guy who taught me gave me the lessons in Telugu. So that was another big learning for me. And when you apply it to your management, it is about leadership. You don't, when you answer something to your boss or your manager, it is expertise. But when you allow your team members to answer it, it shows your leadership. So become leaders, aspire to become leaders. You will get the expertise. You will have the knowledge. But the difference between people who have the knowledge and expertise and a leader, a true leader, is his ability to make the team develop that expertise and to deliver. And I always had in my life people who are empowering me. So if you are a good boss, if you want to be a good boss, you need to empower the people whom you're working with, because only then you will be a great leader. You cannot be a great leader without empowering people who are working with you. And the last thing is, we see in many organizations, I don't know how many of you have had the experience, but you will see in the future as you go by that people in the organization would not be willing to share things with you, share things with the group. They want to keep it all to themselves, thinking that they would become, bigger than the others if they answer it, or they know it, or they know more than the others. But it is actually a sign of insecurity. If you're not insecure, you will share, and you will make sure that everybody around you knows what is happening. And as I told you, I started playing cricket while I was at school. I played all levels of cricket. I was amongst the youngest in the country to play for Ranji Trophy. And this went on. And I joined medical school. I got a seat in medical school in sports quota. And it was not a straightforward thing. It was a big struggle where my dad had to go right up to the Supreme Court to get me my seat. That's another story which I won't go into now. But I was, in those days, playing cricket at that level made me feel like I was a big hero. And I didn't bother about anybody, including my professors at the medical school in the first year. I finished the first year. And when it came to writing the first year examinations, we had to go to our professors and take their signature for allowing us to write the examinations. And my anatomy professor refused to sign my application form, saying that I did not have enough attendance for writing the examinations. I was playing cricket throughout the year, and obviously I would not have had attendance. And I came from a background from a school which allowed me to play cricket, took those extra classes for me, and made sure that I got through the exams. And here I was playing cricket, and I was not being allowed to write the examination. So that was the contrast between the two organizations that I was in. So I had to take a call, and my principal refused to intervene. So I had to lose 6 months because I was not allowed to write the examination. It was then that I had to decide whether that I cannot move on with 2 feet on 2 different boats. So I had to decide between the two. If I was in this situation today, I would have probably said no to medicine, and I would have played cricket, continued to play cricket, because there's a lot more money in cricket and it's a huge career today. But in those days, we used to spend money to play cricket. So it was never a career. The best you could become was you would get a bank job and become a clerk because you played cricket. So I took the option, a difficult decision, of stopping cricket and getting into medicine full time and started studying. So from a very immature situation, which I was, this whole episode helped me turn a lot more mature, taught me how to think about the future and take decisions for the future. And it also taught me that the game itself, the game of cricket itself taught me that you need to play it till the end. You can't give up anyway in between. And the end is very often different. Unexpected endings are very often possible, provided you keep at it and you don't give up halfway. And the choices we make a big difference in life. Like if I had at that point of time decided to continue with cricket and give up medicine, I would have been a clerk or a head clerk in one of the banks and been at that stage. But the choice I took was to do medicine, and I'm here today. So the choices you make, however small they are, make a huge difference in life and at work, for your team, for your institution, for yourself. So be careful when you make your choices. Now, the next thing was, as I told you, I was stopped from writing the examination. And by that time, I was very fast. I don't know how many of you have married or how many of you have fallen in love, but during the first year itself, I fell in love with my batchmate, and I decided to get married to her at that point of time, at the end of the medical school and after graduating from the medical school. But when I was stopped from writing the examination, I knew that she would go a year ahead of me and I would be behind her. And that would be a perfect recipe for disaster, because she was my senior, I was a junior, and there would be a great difficulty in getting married to her. So I decided that I would get married to her right at that stage itself. And it was almost a child marriage. We were just 18 each, and we convinced, at least I convinced my parents, and my parents in turn convinced her parents, and we got married very early at the age of 18. I was really frustrated when I was stopped from writing the examination. And if I had left it alone, it would have been a different story. I probably would not have got married to my wife. I would have not completed my medicine. But I decided at that point of time that I would change. I would act upon that frustration. And the first thing I did was obviously to get married. And once I got married, I realized that I had done something which was not expected of me, and the rest of the people around me, which is my family and her family, gave into our wishes. So I had to live up to their expectations. So from that day, I changed overnight as an academic person, and I did extremely well in my studies. So don't let frustration push you down. A lot of times, frustration pulls you down and keeps you in a different frame of mind, which often is negative. Take the positive side of it and create action out of your frustration, and you will end up with positive results. And just on the lighter side, love before marriage is optional, but after marriage, it is a fundamental thing. So those of you who are not married, please remember that. Those of you who are not married and are in love, remember that love would be a fundamental thing after marriage. And the last thing I wanted to say is never give up. As I said earlier, you will see ups and downs in life all the time. At one moment, you will be on top of the world, and the other moment, you'll be at the bottom of the world. So you are going to see this. You must have already seen it, but as you grow, you'll see more and more of this. But always remember to persist with what you believe is right. Because once you persist with what you believe is right, you will always be right, and you will always be successful in what you are trying to do. Like I decided to get married, and after that, my whole life changed. Then I qualified to become an anesthesiologist, and I was decently okay at anesthesia, because all my life I never put a patient to sleep. I never failed to wake him up after the surgical procedure was over. So obviously I was a decent anesthesiologist. And then Dr. Reddy, who is the chairman of Apollo, and my father had his own hospital, which was a 150-bedded hospital. I was doing extremely well in that hospital. We were doing a good job. But Dr. Reddy, I don't know how he came to know about me. He called me and said, come and join Apollo. I was a little perplexed. And I said, I have my own hospital, and my home family is looking at me to take over that hospital and run it. He said, if you run the nursing home and if you restrict yourself to that nursing home, you will be touching the lives of a select number of people around in that community. But if you come and join me, you will touch many more lives across the country, because I have plans to go across the country and build multiple hospitals across the country. I was really confused. I didn't know what to do. My heart was there because what Dr. Reddy told me really appealed to me. But on the other hand, I couldn't, really face my family, and especially my father, who always thought I would take over that hospital. When I went back and told him, he just said one thing: think what you would enjoy most, think what you are more passionate about, and do it. Don't worry about the hospital. Don't worry about me. Don't worry about the family. Don't worry about anything, but just do what you think you will enjoy the most. So via media, I decided that I would work part-time with Apollo and the rest of the time in the hospital. That's how I started off my journey with Apollo. And gradually, from being a clinician, he gave me the responsibility of there was no emergency medicine in the country at that point of time. He gave me the responsibility of starting the specialty in the country. So more and more time I got involved with Apollo. And finally, after having set up the emergency system across Apollo across the country, the Jubilee Hills Hospital, which is right now in the middle of the best part of the city in Hyderabad, at that point of time was away from the Hyderabad. It was on top of a hill and there was nothing on the hill. So it was not doing well. So he called me and said, now that you've set up the emergency system, take over the administration of this hospital as its CEO. Again, I told him I love my clinical work. I love being with patients. And this is not something which I might enjoy. But he said, do both, try both, and see what you will enjoy most. So I took over as the CEO, and then I realized that as an anesthesiologist, a lot of what you would know, that it's a dependent specialty. You would not get patients on your own. It was always a surgeon who would get the patients, and he would choose the anesthesiologist he would want to take for that surgery. So it was always a dependent specialty. And if I continued to be an anesthesiologist, then and also the CEO of the hospital, then it would be a very, very undue advantage for me, because the surgeons, for want of favors from the administration, would call me as an anesthesiologist for their cases. So I thought it was not right. If I wanted to be an administrator, I cannot be a clinician. So I stopped practicing, although it was my first love. I stopped practicing at that point of time to become a full administrator. So here again, I just wanted to give you a bit of learning of what I got from these episodes. First thing is, opportunities are there for everybody all the time. But a lot of time we don't take opportunities because of the fear of failure. Don't let the fear of failure creep in when you're trying to think about an opportunity and when you're trying to do something. Success and failure are a part of life, but failure should not be the fear of failure should not be something which stops you from doing what you want to do. And always think differently. And when you think differently, you do things differently. And when you do things differently, you will be a different individual. I started off in my childhood thinking that I would be a doctor taking care of a nursing home. And today I'm somewhere else completely away from that field. So you will do different things differently, provided you take the opportunities and you do things differently. And as I already said, I always had an empowering boss. Dr. Reddy never made me feel that I was employed with a particular organization. He made me feel that I was an owner of the organization. So empowering your people who work with you makes a huge difference. Now, I grew up the ladder from the one hospital which I was heading in Jubilee Hills. More and more hospitals started getting added to my responsibility. First, all the hospitals in the then combined Andhra Pradesh. Then all the hospitals, there was a separate region created for me, which was the central region, which included hospitals in Karnataka, Orissa, Gujarat. So this way it became a central region, and I was made the CEO of the central region. And then finally I landed up as the president of the organization, taking care of all the hospitals. So I grew up the ladder that in a stepwise manner over a 15-year period to become the president of the hospitals division of Apollo Group. So again, here, what I realized was professionals strive to make the right decision, while entrepreneurs make the decision right. So do you want to be a professional or do you want to be an entrepreneur? That is something which you need to look at. And you cannot be an entrepreneur unless you have the right professionals working with you. So if you are a good entrepreneur and you want to be a good, successful person, you need to have the right professionals. So the entrepreneur has to be a good professional and entrepreneur, and also employ good professionals to be successful and to make the organization he or she is running successful. Being grounded as you rise is very, very important. A lot of times we tend to forget where we came from. That's not a great sign of a leadership. One of the biggest sign of a good leader is he or she always remembers where he started off and how he came up, and make sure that he is helping others to take the same path and come up the same path. And I remember very well, when you are at the lower end of the ladder, you tend to do a lot of listening. Your bosses, you keep telling you all sorts of things. Everybody keeps telling you all sorts of things. But as you climb up the ladder, you will need to do a lot of talking. It becomes a part of the requirement of becoming a leader. You need to do a lot more talking than you were when you were a junior. But a good leader is only one who becomes a good listener even when he reaches the highest position in the organization. So never stop listening. Listening is the biggest virtue for any leadership position in any organization, for any individual. This is another interesting story. As a part of my responsibility with Apollo, all of you must be knowing that we get the largest number of international patients from about 160 different countries. And I was responsible for the international business of Apollo Hospitals, and I used to travel extensively. Now, this picture shows you with me with two bodyguards. This was in Nigeria, where any foreigner would be just kidnapped for ransom. And it was a part of the culture of that country. So whenever I went there, the government made sure that I had bodyguards with me all the time. That did not, the fear of getting kidnapped did not stop me from going there, because we were getting the highest number of patients from Nigeria. So I had to go back there. And there was another interesting story. The capital of Nigeria is called a place called Abuja, which is about 600 kilometers away from its financial capital called Lagos. So I used to land in Lagos, and to go to Abuja, we had to take a flight. And it was in those days at its infancy. I mean, the flight industry was its infancy in Nigeria. And one fine day, we just got into the flight and we took off. And it was a 45-minute flight. And as we reached Abuja, which is the capital, there was a lot of lightning, and the flight was doing all sorts of tricks. It was, wobbling around, and we could see rain, and it was in a terrible situation. And the captain announced that after 20 minutes of all that terrible experience, he announced that we were going back to Lagos. We were very happy that we were getting out of it. And so we landed in Lagos. And we were happy that we finally were on the ground without getting lost in the air. But as we were trying to get out of the flight, the captain said the doors are shut because the weather is cleared up at Abuja, and we were going to go back to Abuja. 75% of the passengers on the flight did not want to go back because we were all terrified with what we saw in that place. But the captain said nobody can get out of the flight, and he took off. And with God's grace, we landed in Abuja. And as we were landed and we were taxiing, on the left side of the we saw an aircraft which was completely destroyed. And after getting off the flight, I asked somebody what was that aircraft. They told me the previous day there was an accident where a group of school children went for a holiday, and when they were coming back, the flight crashed in Abuja and all of them died. And imagine, the next day, after I finished my work in Abuja, I was supposed to fly back to Lagos. And imagine my plight when I was trying to take a similar flight back from Abuja to Lagos. But I had many such instances in life where there was a huge amount of risk. And I now realize that without taking a risk, you can never achieve anything in life. If you are scared of taking a risk, you will not achieve anything in life. Because just a small act of walking on a road is risky. You don't know who is going to come and bang into you and create an accident there. So there's nothing called 100% risk-free. So risk-taking is a part of life. You need to be judicious. You should be conscious of what you're getting into, and you should make sure that you are aware of the risk mitigation issues as and when and if you land into that risk. And as I said, risk is really inevitable, and it is a part of success at any point of time. And this was one more crazy period in my life. I had just gone to the US and come back from US, and I was a diabetic. So every time my secretary every month gets my blood test done, and as I landed, my secretary said, you have blood test the next day. Blood sugar was the test. So I said, fine. I went fasting to the hospital. There were phlebotomists came to my office and took blood, and I forgot about it just because I was away from work for 2 weeks. I was very busy. I got busy with my work. An hour later, the phlebotomist called me and said, sir, by mistake, I took 2 milliliters of additional blood from you. Which test do you want me to do with that? I said, just throw it away. It's only 2 ml of blood. Just give me my blood sugar test. And about 4 hours later, I got a call from the hematologist in the lab saying that I should go to the lab. I was wondering what was happening. I didn't even have at the back of my mind about my own test. I thought there must be some problem in the lab, so they were calling me to do some firefighting. So I went to the lab. It was all quiet. It was work as usual. And when I went into the hematologist's room, she was a very cheerful lady normally. She was looking very glum, and she was not looking into my eyes. And she was refusing to talk. She said, just sit down, sir. And she was not refusing to talk. A few minutes later, this lady whom you can see in the picture, she was a hemato-oncologist who returned from UK, whom I had just employed 2 weeks before that in our hospital. She walked into the room, and both of them did not talk to me. They were busy looking into the microscope. And finally, they mustered the courage, and this lady, who was Dr. Padmaja, who was my hemato-oncologist, told me that it looks like you have blood cancer and you would need to be treated. I said, you must have got the wrong sample. I'm absolutely fine, no symptoms. I just came back from the US. So how can I be having blood cancer? They said, no, you do have symptoms of blood cancer. I said, you need to repeat it. So they said, they showed me the cells on my slide and said, these are cancer cells. You have to start treatment. I refused, and I said, is there a confirmatory test for this? They said a bone marrow aspiration would have to be done as a confirmation and as a part of the preparation for treatment. So I was in such a denial mode that I said, go ahead and do it now. It's a very painful procedure. As an anesthesiologist, I had given anesthesia for a number of procedures, people who had undergone bone marrow aspiration, and I knew it was a painful procedure. They said, no, you come fasting the next day and we'll do it next day. But I wanted to prove it that it was not blood cancer. So I said, do it under local anesthesia and do it right now. And being the boss, they could not say no to me. So they tried to persuade me. When I did not agree, they did it under local anesthesia. And a couple of hours later, they came back to me and said, it is blood cancer and you have to undergo treatment. So from coming back from my daughter in the US and all the fun, I ended up in a situation which was pretty glum. Then I called my family, my wife and parents, and told them this, and got admitted into the hospital the very next day. By the time which all the reports came in, and I was given a choice of treatment. They had done a lot of consultation across the world, and for the type of cancer I had, there were two types of treatment. One was the chemotherapy. Doctors would know. Those who undergo chemotherapy, it's very toxic. People become, very lean, and lose all their hair, and they'll become pathetic. And the chemotherapy for this particular type of cancer was cardiotoxic. It was, toxic to the heart also. And there was another form of treatment, which was not chemotherapy, but which was a high dose of vitamin A and arsenic. So they said, you choose. I said, what is the outcome? They said the outcomes are similar for both types of regimen, although it is slightly better for chemotherapy. So I said, I don't want to have the side effects of chemotherapy, and I chose to go ahead with the alternative mode of treatment. And for 9 months, I was arrested in a room, and I was not allowed to meet anybody except my family, and I was undergoing chemotherapy. But at that point of time, I realized the importance of the support that you require, both from the family, from friends, and from the organization you work with. I managed to get through those 9 months because I worked continuously through the 9 months from that room where I was locked in. As you can see there, I was a patient. You can all see my face and all that. You can actually see me working here. And they actually created an entire office space within my room. I continued to work, and I went through the 9 months. And at the end of which, they said that I've been I'm now cured of chemotherapy, of the cancer, and it's been 6 years now, which after continuous monitoring, with God's grace, it's not repeated or reoccurred. So that was a great period of learning for me. First thing is, we believe that a lot of things are a waste. Remember, if that 2 ml of blood, which was taken in addition, was thrown away, I would have been diagnosed with blood cancer at a much more advanced stage, and probably I would not have had made it because of the advanced stage of at which I was diagnosed. So nothing goes waste. Please remember that. In life, at work, nothing is a waste. And leadership is not about knowing everything. It is about implementing what you know. That is very, very important. Nobody knows everything. But if you make use of what you know, and you can make use of what you know only when you have a team which has the buy-in with what you want to do, and you have the resources, and that create the environment of making that a successful thing. And if you take things for granted, like I did at the beginning of when I was told that I had blood cancer, be assured that it is a perfect recipe for failure. So never take anything for granted. Please make sure that, please understand that everything has a meaning to it, and there is some importance which needs to be given to everything. And as I told you, all through my treatment, I remained positive, and positivity actually helped me adapt to a new environment. All my life, I was running around, traveling. In those days, I used to travel almost 6 days a week out of the city and all over the world. So I had to be stuck in a room for 9 months continuously, and that was only possible because of the positive environment which was created, and which did not, and self-pity is another thing which I see a lot of people getting into. That is again self-destructive. Please don't pity on yourself. Never allow that to come in, because you're destroying yourself. Instead, think about what next. The first thing I want to assure you is all these pictures you see are of mine. They're not of different people. They're all me. Why I put this up is, after I recovered from cancer, during the period of cancer, I got so much of love and affection from the family, from the team which I worked with, from the hospital employees whom I worked with, from the institution, and it was really mind-boggling. Then I thought that God has given me a chance by coming out of this cancer, and I need to give back something to the society. And what can stop me from giving back something from the society to the society? I was obese, as you can see. I was a severe diabetic on 5 medications, still without control. The diabetes would not come under control with 5 medications. I was severe hypertensive. I was a smoker, wanted to give up smoking, and I thought chewing tobacco was a better alternative, so I started chewing tobacco. So I was on tobacco. That was again a good recipe for cancer and this thing. There was a tremendous amount of stress I would take at work, and that was all this was a perfect recipe for a heart disease. And any moment I could have had a heart attack or a stroke or any of these non-communicable diseases. So I decided to do something on it, and I really worked hard to transform from where I was to what I am today. So a lot of people in the beginning, I myself used to feel I'm 120 kgs. The ideal weight for me is 65 or lower than 65. How the hell can I get from 120 kgs to 65 kgs? But once I started working on it, I realized that it was possible. So it is all in your mind. If you think it is possible, it is definitely possible. But the beginning is always going to be difficult. So you need to make up your mind that you're going to go all the way, and keep your mind and keep yourself at it. If you do that, you are going to achieve it. The next thing, which relates very well to the work environment, to your personal environment, to any environment, is you need to be emotionally attached with what you're doing. The emotional component of what you're doing makes a huge difference to the outcome of what you're doing. I was very emotional when I came out of the cancer, and I was really emotional about giving back something to the people who have helped me so much. So that emotional connect makes a huge difference, and it is a proven thing in management that the emotional connect that you have with your organization, with your teams, with the work you do, makes a huge difference in the outcomes in this thing. And a lot of people ask me whether I had bariatric surgery to lose so much of weight. I never had bariatric surgery. And I knew that it was not just about losing weight. It was about changing the way I lived. It was about managing my lifestyle. So you need to think 360 degrees to get to a solution. Don't think about just one aspect of it. Obesity was one aspect of what I had as a problem. But if I stuck to get rid of my obesity, I would have probably taken the easy route out, got a bariatric surgery done, and lost probably 15-20 kgs, and there it would have ended. But you need to think about it in a comprehensive manner to ultimately reach where you want to reach. Don't think about it in piece and small bits. You'll never succeed and never reach your goal. But at the same time, have small goals and celebrate when you achieve these small goals, because when you add up all these small goals, the end outcome is transformative. So to reach that transformation, you would need to have these small goals and celebrate these small goals. And always remember, in life, you're on the move. Life is on the move. You are either moving up or down. So if you think that you've done everything in life and you reach the highest part of your life, you are at the peak of it, remember, you will never remain at the peak of it. The next step is you will start sliding down the road, down the hill. So always make sure that you are looking at something new and looking at something ahead of you, something higher, something better than what you're doing currently, irrespective of what you've achieved in life. A lot of people ask me, did you eat anything? Do you eat anything? And this is what I eat. Doesn't it look really good? Very yummy. But believe me, each of these dishes, what you see on the thing are what I eat almost alternate days. And all these are zero carb. All these are zero carb, no calories. And they're all made out of material, they all, which does not contain, like this bread you see is a zero carb almond flour bread which they made that sandwich with. And this pasta sort of thing which is made is zero carb again. So why I put this slide up is, if you do not innovate, you will perish. You need to innovate. If to achieve something in life, if you want to do the same thing over and over again, you will never achieve anything new. So you need to innovate. So if I had to lose weight, I had to make sure that I took minimal calories, and I always had a calorie deficit. But and I knew that if I stopped eating, or my craving for eating would increase, and I would actually put on more weight. So I had to innovate and find food which I would relish, which would satiate me, but at the same time not allow me to be calorie positive. So be innovative, think of innovation, and live and breathe innovation. Now, all of you are in healthcare, so it is worth talking a little bit about healthcare. Now, thanks to COVID, now that reminds me, probably God gave me a chance to live after the cancer because of COVID. Because believe me, the last 20 months have been the toughest 20 months for me in my lifetime. Whether it was from getting protective equipment during the first wave when the COVID first came in, we have a large organization, and we were the port of first call for many people who had COVID. We ourselves did not know what COVID was when it struck. So what was the solution we were going to provide the people? So there was a huge amount of pressure on us. And first, to protect our own people, our employees, then protect our patients who are non-COVID patients, and also take care of the COVID patients. And we had no resources, no infrastructure, no knowledge about COVID. So, and then came the second wave where there was no oxygen. There were, I used to get calls from hospitals in the middle of the night, a Delhi hospital calling me saying that they have just 2 hours of oxygen left and there are 200 patients on oxygen and all of them would die. So we had to work like, 24 hours a day to be able to, and I would get calls from everybody, starting from the PMO to everybody. I used to get calls, my phone would never stop ringing for beds. And beds we really innovated and created beds under tents. We created ICUs under tents. We created ICUs in the corridors of the hospital. We did all sorts of things. But one thing which satisfies me the most at this point of time is we did not deprive care to even one patient who came into our system. We would have taken care of about 200,000 COVID patients so far, but we did not deprive care to anybody, either because of lack of resources or manpower or money. That's the huge satisfaction that I have at this point of time. But something more relevant to you guys is you need to understand that COVID is actually accelerated a great change that is happening in healthcare. Healthcare is not going to be what it was and what it is at this point of time. You would need to understand that, because unless you understand that, you will be lost. Healthcare is gone through multiple changes. New models of healthcare have evolved, whether it is telehealth, whether it is home healthcare, you name it. A lot of new things have come in, and a lot of new things people believe will not last. But I firmly believe that all these new models of healthcare are here to survive. And many of the models are still evolving. So you have an opportunity as a youngster to become a part of this evolution and make sure that you are not lost in this game of healthcare, which is changing. And for me, I put the future of healthcare in 5 Ps. The first one is there is going to be a lot more emphasis on preventive healthcare. Lot more emphasis on preventive healthcare. In the past, when we used to ask people to have a preventive health check, people never used to come forward because their fear was, if I have a preventive health check, they would diagnose something and I would have to go through a procedure. So people would never go through a preventive health check. Now, you just imagine the whole world shut itself behind the 4 doors in their homes for months together to prevent COVID infection. So see the dramatic change which has occurred in preventive healthcare. So a lot more emphasis is going to happen on preventive healthcare. And as you would all know by now, non-communicable diseases like heart attacks, you would see young guys just falling and dying like flies because of heart attacks today. Strokes, cancer, road traffic accidents, all these are going to become big things, and no country would have the resources and the money to treat all the sickness that is going to come its way. So preventive healthcare is the only way that a country can survive in terms of healthcare. So it is going to play a big role in the future. Proactive care. All of us know that prevention is the best cure. Early diagnosis and treatment is the next best. So it is going to get more and more proactive. Now, when you talk about preventive healthcare, it depends on what type of tests you're doing. Today, we have the ability to predict whether somebody has got the probability of getting a heart attack. We have the ability to predict whether somebody is going to get cancer. So there's going to be a lot more predictive care that is going to come into picture because we have gone down to the genetic level of understanding an individual. We use artificial intelligence, and we use a lot of other technology that's come into this thing to predict the possibility of a particular ailment, not just in the individuals who are living today, but even within the fetus which is in the mother's body. We can really predict what's going to happen to that fetus and what's the diseases. That's why you'll see today a lot of parents actually storing the umbilical cord blood of the child when they come in. So banking of the neonatal blood has become a big story today. Precision medicine is going to become the next big thing, because let me take the example of cancer. In the past, radiation, it would burn a lot of area around the tumor also when you gave radiation. So apart from the cancer itself, the treatment itself would add to the morbidity of the individual. Today, your radiation machines have become so precise that it burns only the cancer cells and nothing beyond that. You got the proton therapy, which is really the most accurate cutting-edge therapy, radiotherapy for cancer. Then you got the various robots across the system, which are highly precise. So you are going to see a lot of precision medicine happening. And the last P is partnerships. Apollo by itself, or the government by itself, or a small clinic by itself is never going to be able to be successful in the future. Partnerships are going to make a huge difference in the future. You see a lot of consolidation happening in the healthcare industry, and that's going to continue. So partnerships are the next big thing. In fact, my prediction is in the future, the number of beds in a hospital is going to become irrelevant, because I've seen in my lifetime, the average length of stay of a patient in a hospital has moved from what used to be 10 a few years ago to 2.3 to 3 with more complex procedures and more. If you remember, a patient who had a bypass surgery would be in the hospital for 15 days after bypass surgery. Today, they go out the next day because we're doing minimally invasive bypass surgery or robotic bypass surgery. So it is not the number of beds which is going to become more important. What is going to become more important are these 5 Ps and the new models of care which are going to be based on these 5 Ps, which will make a big difference for you guys in the future. And I strongly recommend that you work towards this, you explore this, think about it, and brainstorm on these 5 Ps. And whatever I've done so far, it's been all done, but I still believe that there's a lot more that needs to be done. And I'm more than happy to work with any one of you who wants to work with me and do something new, because doing something new gives you a lot of excitement, gives you a lot of kick. So I'm always work in progress, and I'm more than happy to join any one of you in the future. So that is what I want to share with you. I don't know how much time I've taken, because these are a lot of these things are personal things. I probably went over time. What's the time now? I've spent an hour on this, but still I'll take questions if there are any.
Sure, sir. Thank you for your inspiring talk. And there are many questions from our friends, but yeah, we'll quickly take a few questions. So one of the questions which has come from Sudhakar, like you have been with Apollo for a long time, and some of us are actually fortunate to have worked with you earlier. So what, according to you, are 3 important things Apollo is so successful in India? If you can give some insights.
I think the first thing is it is the passion. Apollo is built around passion, because it was started by a doctor who gave up a very luxurious life in the US. He was a very popular cardiologist, Dr. Reddy, and he came back, and he believed that when Indian doctors could do so well in UK and US, why can't they do well in their own country? Why should an Indian travel abroad for treatment? So it was born out of that passion, and that passion continues. He made it a sustainable thing. No business or no initiative, I don't want to call it business, but no initiative will be successful unless it is sustainable. And healthcare, for it to be sustainable, you need money to make it sustainable. And therefore, profits are not a bad word in healthcare, particularly on the private sector, because the technology becomes obsolete every 5 years. You would need to replace technology every 5 years. And where would you get the money from? Nobody is going to donate money to you like they do in the US. The government doesn't give you money. And if you don't become sustainable, you will not be successful. Hospitals will start shutting down. So the biggest factor, 2 factors I would call it, 3 I would call in fact. One is the passion for it. 2 is to ensure sustainability. And 3rd is to make everybody within the organization feel that they are the entrepreneurs. We call ourselves the Apollo family. We don't call our people employees and bosses. We all call ourselves the Apollo family. I think these are the 3 factors which have helped Apollo grow to what it is today.
Thank you, sir. Thank you, sir. And as you know, many clinicians are showing inclination towards become administrators. So there is a specific question from some of the clinicians, like as a clinician, you have a vision, but your vision doesn't coincide with the organization's vision. How do you deal with that kind of situation?
I had a lot of hair before I became an administrator. I lost all my hair after I became an administrator. Because this is a constant, there is always a friction which happens between a clinician and an administrator. And when a clinician becomes an administrator, it becomes even worse for him, because he understands both sides of the coin. If you are just an administrator, you will stick to your side of the coin and only argue on that. Or if you remain a clinician, you'll only argue on one side of the story. But once you become an administrator, you would have to look at it, as I said, in a 360 perspective, and make sure that one of the biggest things as an administrator you're faced today on a day-to-day is to solve issues, to solve problems, to provide solutions. And when you are a clinician and have become an administrator, you need to be taking decisions, taking advantage of the clinical knowledge that you have to take an administrative decision, or to take the advantage of the administrative knowledge that you have to take a clinical decision. So it gives you that sort of an advantage. So I actually encourage clinicians to become administrators, but I also say a good clinician becoming an administrator is a huge loss to the clinical fraternity, is a huge loss to the patients. So I always advise good clinicians to remain as clinicians, but it would always help to have a little bit of administrative knowledge, because that would give them a perspective from an institutional view.
Thank you, sir. The next question, as a leader, I mean, it takes a lot from you. It's demanding. What is your advice for the young generation to have that work and life balance and still prosper in your work? How we can have that work-life balance?
See, it all depends on you. I'm being very honest. It depends on your perspective of life. As I told you, before I had cancer, I was taking a lot of stress, huge amount of stress. Every small thing used to be stressful now for me. But after having finished with my cancer, when I look at it from a different perspective, the stress is much lower. So it all depends on how you look at a problem. If you look at it as a problem, then solving it becomes a stress. But if you look at it as an opportunity, then it becomes fine. It becomes fun to, really make use of that opportunity to create a solution. So don't look at things as a problem. Look at things as an opportunity, and stress automatically comes down. And the second thing which I would like to advise you is, you need to do something beyond your routine. You need to have some passion beyond your routine. Apart from being an administrator or a clinician or a professional, you should enjoy something else. For me today, I enjoy going to the gym, and I enjoy doing my workout very, very regularly, irrespective of what happens. So that actually de-stresses me a lot. So there are two things: the way you look at your work and the way you de-stress outside your work. Both are equally important.
Thank you, sir. Another question about choices. You mentioned that life is all about making right choices. But here is a question around any wrong decision you have made in life and how that has made you a better person or a better leader. You can give some insights around that.
Good question. As I told you, I used to smoke, right? And as a doctor, I always knew that it was very bad for me. And the problem with smoking was I could not smoke anywhere and everywhere, right? You had to go and find a place to smoke. So I was looking at an alternative for it. So then I realized that chewing pan with tobacco was a good alternative, because you can do it all the time. You can sit in your room and do it all the time. And I thought it would not harm my lungs as much as smoking would harm. So I changed over to chewing pan. Now, once I started chewing pan, I would not talk, I would only listen, because I had that pan in my mouth, and if I opened my mouth, the whole thing would be on the face of the person sitting in front of me. So then I had to find another alternative to give up pan. Then what I started doing was, why do I need a pan? Why can't I chew tobacco by itself? So I started chewing raw tobacco. So you see, what happens is, to cover up one mistake, I went on making more mistakes. And I think I really repent having smoked the first cigarette. Had I not smoked the first cigarette, I would not have gone through all this in my life. And today I'm pretty sure that my tobacco habit was probably responsible for the blood cancer that I had. So if you're not, if any one of you are smokers, please stop smoking today. If you're not smokers, don't take that first cigarette into your hand.
Very insightful, sir. There are many questions coming from friends, but there is a special question. We have a lot of women in our class. They want to be good leaders. Any special message for women leaders for future?
Women leaders or good leaders? What did you say?
When we have many girls in our class, they also want to be top leaders. So usually you don't see much, women leaders in our country. Any special message you have for them?
First thing is, I want to warn all the boys in the class to be very careful, because very slowly, but for sure, women are taking over. So if you want to survive, you would have to do better than women. Please do remember that first. Second thing is, my bosses are all 4 women. All the daughters of Dr. Reddy are all women. And let me assure you, they bring a different angle to leadership. And that is one single thing which I want to say is, women are more empathetic than men can ever be. And that actually is a huge add-on for any leader. A leader who is empathetic is at a different level compared to everybody else. So all the boys, please take special classes on empathy, or you will lose out to women.
Thank you, sir. Rajesh, you have a question, you can unmute and ask. After that, Shilpa, I think we can wrap up this session. Thank you, sir, for a wonderful session. Would love to hear from you again and again. This session we are recording so that we can hear you again and again. Rajesh.
Yeah. Good afternoon, sir.
Good afternoon.
Sir, it was nice listening to you. And as I feel the grass on the other side is always greener, So I am other way around. I am an administrator and now trying to go towards clinical side. First question was that will it be a good journey? Second question was basically, sir, by virtue of being into around 15-16 years of administration, I have been into good brands like Paras, Cloud9, Fortis. What I have seen that the moment we start trying for excellence in our professional life, somewhere family life is basically compromised. So what is your mantra for making work-life balance?
Right. First thing is, which specialty are you in?
Sir, I'm into hospital administration.
No, you said you wanted to move into clinical
anesthesia.
Anesthesia, okay. Actually, what I have noticed, I don't know if a formal study or a scientific study has been done, but actually anesthesiologists make good administrators. And I've seen a lot of anesthesiologists being administrators. And when I try to reason out why, one of the things which a good anesthetist has to have is the ability to manage the idiosyncrasies of a surgeon. Well, each surgeon has got his or her own idiosyncrasy. And second thing is, whether the surgeons like it or not, it is the anesthesiologist who makes all the difference in the operating theater. Whether coordinating the different people who are in the theater. And it is only the anesthesiologist who can kill a patient in the theater. A surgeon can never kill a patient in the theater.
Yes, sir.
So that is the sort of responsibility the anesthesiologist has on him or her. So with all these factors, I think there is some amount of inborn leadership qualities in an anesthesiologist compared to any of the other clinicians. And if you are really passionate about it, I will encourage you to move on to clinical work, because all your administrative knowledge which you've gained so far will be helpful for you in becoming a successful anesthesiologist. One. Second thing is about life balance, personal life versus professional life. I think it is about setting expectations. Life is full of setting expectations. You want to achieve something and you're a married man, you're no more alone You are a part of a larger ecosystem, which includes your family, which includes your work. So you need to set the expectations at work, you need to set the expectations at family, and both these need to be in reciprocation of each other. They can't be independent of each other. So when you set the expectations right, both at work and at home, then the balance happens perfectly. On the other hand, if you don't do that, if you are only about work and you don't have you did not set the expectation right at home, then you would have a problem at home, and the other way around is also possible. So I think it is about setting the expectations right.
So one additional thing, because you are at a very senior administrative position, so am I. So availability on WhatsApp basically is a problem. At workplace, everyone expects you to be on WhatsApp always, even on off hours.
I can tell you that from my own way of thinking, everybody has a right to think his own way and has a right to do it the way he or she wants to. But I think one of the most important attributes for your success as an administrator is communication. It is very, very important. And by communication, I just not mean talking to each other or anything like that. It is being available when you are required. It is the ease of reaching out to somebody. It is the speed of reaching out to somebody. I can tell you from my experience that WhatsApp has really changed the way that we communicate with each other. And it has actually saved time for individuals in a big way, because I've seen it through the pandemic. I've been able to manage 72 hospitals, 6,000 COVID and 6,000 non-COVID beds on WhatsApp, even when I myself was under quarantine with COVID. So I find it a great tool, and especially once it comes to, forming groups, making at the same time you want to call. I mean, one of the challenges I faced was there were 72 hospitals which were managing COVID, and the protocol for managing COVID would change by the day. Something would happen in Europe and that would become a standard of care here. Now, imagine the challenge of communicating that to 72 hospitals.
Yes, sir.
What we did was formed a simple WhatsApp group called the COVID Management Group, and that became the standard for communication across the system. But I do understand that it is being misused also. I think there is always misuse for anything. Even the best thing is misused, but we should judge it by its use rather than misuse. So I'm a big fan of WhatsApp, and I believe it is really good, provided it's used in the right manner.
So I think Dr. Jaiman, you have a question. If you can quickly ask, then we'll wrap up this session.
Thanks, sir.
Yes, sir. Good afternoon, sir. It's an honor to connect with you, sir.
Hi.
Sir, one question, sir. What is the right place to start for, let's just say, a small nursing home or wherever, if somebody's starting out in the management journey and, if a hospital has never been formally managed, what is the right place to start with the management of a small nursing home to transform it into a corporate culture, so to say? And secondly, sir, which department in the hospital do you think is the most important when it comes to administration? Is it the marketing? Is it the HR? Is it the clinical or a non-clinical department? What is your take on it?
Right. Now, first thing is about the nursing home part of it, which is a small nursing home. I don't believe anything is small or big. I believe that it is when you are involved with it with passion, with a process, and with systems, it doesn't matter how small it is or how big it is. So even if it's a small hospital, work with the same passion and become more oriented towards the processes and systems rather than individuals. And then automatically it starts, you will look at it from a different perspective and it will grow in a different manner. What was the second question you asked?
So second was, which department do you think is the most important? Like HR, marketing, clinical department, like what should a hospital focus on?
None of the departments are important. None of the departments. I think what you should understand is, in healthcare, the most important person is the patient. If you put the patient in the center and everything else revolves around it, and if you are taking decisions or forming policies or processes or systems with the patient at the center for the benefit of the patient, let me assure you that you're taking the right decision all the time. But if you try to see which is within your hospital, which department is more important, then you're losing the game.
Thank you so much, sir. Thank you.
Yeah. Good afternoon, everyone. Good afternoon, sir. This is Shilpa.
Hi.
Hi. Yeah. So it's an honor for me to propose vote of thanks for today to all of them who have helped us to make this session a success. Thank you so very much. Firstly, thank you so much, sir, for taking your Sunday off and being with us. And, thank you so much for inspiring us with your phenomenal personal journey and as well as professional journey. And it was a very fun-loving session, I believe. And thank you so much for emphasizing on family values and also patient values. And thank you so very much, sir. And we look forward to your support in our future endeavors. So, and thank you, Soumya. Thank you so much. Thank you so very much for supporting us and for encouraging us to have these kind of sessions. And thank you, JP, sir, for bringing us Dr. Hari Prasad, sir, to us today. Thank you, Smita, for promoting this event successfully. And thank you, PGP students and our seniors who are here attending this session. And finally, the class, AMPH 2022, thank you so much for being here. Thank you so very much.
I just want to say that I put my email on the chat. Anybody needs anything, please don't hesitate to contact me. It's always a privilege to be of help and support people who are trying to do something in life. All the best.
Thank you.
Thank you,
so
sir.
much,
Have a
sir.
nice day.
Thank you so much.
sir. Thank you so much, sir.
Thank you so much, sir.
Thank you, sir.
Bye-bye.
Thank you, sir.
Thank you, sir.
Thank you, sir. Bye-bye.
Thank you so much, sir.
Thank you, sir.